My name is Nils Henninger. I'm a neurologist, associate professor at the University of Massachusetts Chan Medical School. ALS is a disease that predominantly affects motor neurons in the brain and spinal cord. What strikes me personally is that when you look at these ALS patients, you find that most of them, with exceptions, have an abnormal pattern of a protein called TDP43. It's distributed in a way that's usually not the case. And the same abnormal distribution pattern is also found in patients after traumatic brain injury. So there may be some shared mechanisms that go on in the brain and drive disease. And in fact, when you look at epidemiological data, patients with a history of TBI, maybe even if they're multiple, they have about twofold higher risk of developing ALS, further contributing to the idea that there's a link between these two diseases. So back in 2016, our lab established the role of a protein called SOM1 in driving axonal degeneration after traumatic brain injury. And since then, we and others have established a much broader role of this protein SOM1, not only for neurodegeneration and TBI, but also many other diseases, including, based on most recent data, in ALS. In human ALS patients, rare variants of this protein have been identified that predispose neurons to die in the context of mild, otherwise harmless stress. And what we found in studies supported by the Angel Fund is that if we eliminate this protein from our ALS mice, they are protected from the adverse effects of a traumatic brain injury. What we believe is that by targeting SOM1, we may be able to provide neuroprotection, treating the disease, halt the disease progression in ALS patients. And currently, together with other investigators of UMass Chan, we're developing a novel therapy that's specifically seeking to reduce the amounts of this protein SOM1 in neurons. And we hope that this will halt disease and ultimately, if true, develop this further for the treatment of ALS patients. Now, this kind of high-risk, high-reward research could not have been done without support from the Angel Fund. And I'm deeply grateful for this. Thank you.